Hi, Ace Battisti with Careerma.com. We have another interview for you. As we continue to interview physicians, we will be sending you the recordings so you can see the physicians and get even more perspective regarding what it's like to be a physician. Our first guest here today is Mike Pollack. He has degrees from Harvard in physics and medicine. He completed a residency in radiology at the University of California at San Francisco and also did a fellowship in musculoskeletal imaging at UCSF. He was the medical director of Oklahoma Diagnostic Imaging in Oklahoma City for 25 years. So I'm really excited about this interview. Mike is a very, very bright guy, and I'm sure he's going to give you some really honest, truthful, and excellent insight into the field of medicine. Mike, hey, thanks so much for joining us on the call. How are you doing?
I'm great. How are you doing?
Good, thanks. Well, tell us a little bit about medical school first. I know that you attended Harvard and you got an MPH. Tell us about that.
Well, I had a great experience. I was at Harvard for a total of eight years, living in Cambridge and then Boston. And it's a great town to live in if you're a student. So many other students and so much to do and see. So I loved my time at Harvard, and I wasn't certain what specialty I wanted to go into. I thought about radiology early on, but I didn't know that much about it. And I had heard that in order to get, at that point in time, radiology was extremely competitive. It was highly regarded, and a lot of new technology coming in. It was right around the very start of MRI, so MRI was not common at all at that point. But you heard about it and heard how exciting it was. And I was a physics major as an undergraduate, so I had an attraction and an interest in technology and the physics and so radiology was a natural for me. I wasn't sure if it was the perfect fit for me or not, and I had heard that in order to get into a good radiology program, you needed to get an excellent grade. At that point, at least at Harvard, there was kind of a pass-fail excellent system. You did either satisfactory or excellent or fail, and it was some specialties were tougher than others to get a good mark in, and I had heard that in radiology you have to communicate with all kinds of different other specialists, and that they really would like to see you have an excellent grade in internal medicine and surgery at least, and others as well. So I put my all into doing my best possible especially on those rotations, the surgery and the internal medicine. And I got so engrossed in those that it made me feel like I wanted to go into those. And I remember at the end of third year, I had just finished my internal medicine rotation, and I was exhausted from all the effort I put into it and the long hours. And I was suddenly confused about what I thought maybe I want to go into internal medicine and not radiology. And I just was more than anything exhausted, and on an impulse, on a whim, I remember being up on the roof of the apartment that we lived in, 6 of us students, and it suddenly hit me that I was going to take a year off and think about things, and that a good thing for me to do during that time would be to go to the School of Public Health, which had a program. Normally a Master's of Public Health is 2 years to do, but they had a program where if you were an MD student, you could attend for 1 year and complete the requirements for both 1 extra year and complete the requirements for an MPH as well as a MD. So that's what I decided to do, and it was a tremendous experience and a good choice. I decided, as far as helping me choose the career path, I made an arrangement to go attend the weekly clinic of the chief resident of internal medicine, a few hours a week, and it didn't take me more than maybe a month of that to realize that I did not want to go into internal medicine. That possibly, if hospitalist had been available at that point, I might have thought differently, but it just the outpatient and the diabetes management just weren't for me. So I quickly
Right.
realized that. But I also, in the course of that year, I met a lot of people who were interested in the same things. There were maybe a fifth of the class was, or maybe a tenth of the class was MDs or already medical students, or mainly people who already had MDs and had been out in practice, especially in international institutions or governmental from other countries, governmental bodies or health services. Um, I was kind of one of the exceptional med students, but some of them had maybe came from Greece, let's say, and been involved in the Ministry of Health there, and were coming for a year to Harvard School of Public Health to study the administrative and other things, skills they needed to work on to function in their jobs. I became interested in all the administrative and the business side. It's almost the administration and economics part of the School of Public Health. It's almost a mini business school for health pursuits, with a lot of people in health fields that have an interest in the business side of medicine and the economics of medicine and so forth. So there are a lot of like-minded people, and I picked up along the way. I took accounting courses and investment courses, finance courses, uh, entrepreneurial courses. We could cross-register at Harvard Business School and at the MIT Sloan School of Management, and in fact, I did take a class with a couple of other MD friends, one from Norway and one from an American doctor, and we took a class called Entrepreneurship in Medicine, and we made a business plan to how we were going to start our own health, basically what's now the health management networks. But it was a tremendous experience, a lot of fun. Compared to medical school, much less work. So it was like a year off, but I got an MPH out of it and had fun in the process.
Wow, that's great. So you'd say that you use some of those skills as director of an outpatient imaging center?
Absolutely, I used. I mean, a lot of it is skills that I think every person out in the economy should know. Basic things about accounting and finance, and
Mm.
it gave me an understanding. It gave me a comfort with reading budgets and with analyzing economic, financial information, financial analysis. I've forgotten anything I haven't used, and we're talking about 30 years ago. So anything that I haven't used regularly since then, I can't say I remember now, but necessarily. But at the time, I had a very good understanding and comfort level with all of that, and I think had my career path turned in a different direction, I would have been well prepared for a number of different things. So I think that degree is a very powerful combination degree, and something that, well, let me just say that since most people aren't going to do it and can't do it, it's not practical. That some of those skills should really be taught in medical school, because they're things that doctors should know in general. Most doctors are not comfortable at all with accounting and talking to financial types, and that lack of knowledge leads to a lack of confidence, and I think that's part of what is disempowering doctors today. They feel intimidated by their lack of knowledge, and probably on purpose used to manipulate them into submission, into being controlled by management types, the suits.
I think so too. I think it's really unfortunate that physicians don't get more business. Of course, as an undergrad, I didn't take any business. I didn't have the foresight to take any business classes, and then of course I didn't get any in medical school. And I tried to make up for that later on in life and learn some business skills. But there's no substitute for having some formal business education. And I really think that medical students should have some. And
Yeah.
I encourage people to
Some of it's things that in any field that you do go into, it would help to know some accounting and some finance and investment and some principles of economics that somebody might get in an undergraduate experience, but more often they don't.
Exactly. Let's talk about your career as a radiologist. Tell me some of the things that you found gratifying about it.
Well, I was always attracted, as I said, to the technology side, and I mean, to me, radiology was cool and is cool because in a technological way, I love how it can provide, basically see what's inside people without actually opening them up. There's so many times over the years of my practice that we made an important diagnosis or discovered a very unsuspected finding that had tremendous import to a patient. And I think you're not automatically respected as a radiologist. There's some other doctors that have a tendency to look down on radiologists as not being real doctors, or there's that potential anyway. So you have to earn their respect, and you do that by by being able to contribute in a meaningful way to the care of a patient. And I think if that's present, then you get the respect. It's not anything inherent in the field. It's just you have to earn it because they don't necessarily they see you as having an easier time, which I won't argue with that. Our call was certainly better. My call over the years of practice was better than an OBGYN. and I don't apologize for that. One of the reasons I went into the field. But I think we do make an enormous contribution to the care of patients, and when we are doing a good job of it, I think the clinicians, the referring doctors, recognize that, and there's plenty of respect to be gained from that.
Exactly, I agree. What about some of the frustrations? Tell prospective radiology students what some of the frustrations.
I wouldn't. Radiology has when I entered practice, it was what might be considered the golden age of radiology, where radiologists were making, sometimes be the second or the first, second or third highest paid specialties and rankings, which is always it's a mixed blessing. You feel good about that, but you realize that that's attracting some unwanted attention. And in fact, the government keyed into that, and every year for the first 5 years maybe I was in practice, it was still the golden years, and then every year since then there's been a gradual ratcheting back. Actually, that started when I was at the School of Public Health. There's a Dr. Bill Shao that was involved with setting up DRGs, and that was a big new thing at the time. Now people would kill to go back to those days now, but ever since then there's been a progressive ratcheting down of reimbursement. So we're working in radiology and in other areas of medicine. We're working, doing more and making less. Fortunately, that is possible because of the efficiencies created by technology. So in radiology, we have the PACS workstations, and you can probably read maybe twice as fast. So you can do twice as many cases as you used to be able to. But I think we're reaching the limits of that, because now the current techniques and scanners with thinner slices and spiral CT data, you generate an enormous number of images, and we're still medical legally responsible for what's on each of the 500 images in a data set, as we are in one chest X-ray exam that has 2 images to look at. And you're expected medical legally to find everything that needs to be found in hundreds of images. So it's gotten a little out of control that way too. Well, I think that's behind the whole trend towards physicians becoming employees.
Yeah,
we were in much better shape when we were in single specialty groups. It works against radiologists, at least, to be in multi-specialty groups, because there's resentment from the other members of the group in other fields. And then it works against all physicians to be employees of a hospital. It may seem attractive at first, but you've ceded a lot of the control over your life to someone who's not even a doctor, most likely, or not even in practice, and it's just asking for trouble.
I think so, and I feel bad for a lot of the primary care physicians who are involved in those situations. They have quotas and they have to see a certain number of patients every day,
And they may be attracted at first by maybe it offers a little bit better pay than they were making, but it's just not worth it. It's a deal with the devil, in my opinion.
right, exactly. I couldn't agree more.
And they're selling, and that's probably too strong a word. They're setting the stage like it may not in their practice lifetime go very all the way south, but they're kind of letting the enemy in the gate and setting it up to cause further problems down the road. There's nothing about it has to be permanent though. All these trends could be reversed and even completely stopped and eradicated if physicians got together and didn't allow it anymore.
You know, as far as trends go, when we make predictions, there's some speculation, but would you care to make any predictions regarding the trends that you think will follow through over the next 10 years in medicine?
Well, in the short term, I see continued trend towards physicians becoming employees. For the reasons we talked about, they're generally not comfortable taking the business risk, and they like the ease of someone else managing the business operation, but there's a price to be, no risk, no reward. If you ask for the easy path and the guaranteed results and income, then you also don't share in the upside if you're successful. So it's making medicine less entrepreneurial and more like a corporate practice and employees and all that entails, rather than if a physician traditionally was captain of the ship. A physician in solo practice or a single specialty group practice basically ran a small business of pretty significant magnitude. And now, in many cases, if you're employed by a hospital, then you're just an employee in an organization.
Well, I think one of the things that happens, at least as far as radiologists who are employed by hospitals, is they are paid a set salary, and that salary generally doesn't change. Sometimes there are bonuses built in, but generally they're paid a certain amount. Yet they have to do all the work, whether it's 80 cases a day or 180 cases a day, and they still have to do it, and they end up getting paid the same amount. So that's an important aspect of control that
the motivations
lost.
Are obviously, I mean, it seems like something obvious, but people tend to forget it, that whatever economic system you have in place creates incentives and disincentives, and people respond to that. People notice what those are and respond to it. There was a period where I briefly did some moonlighting in Phoenix, Arizona, that at that time had much more managed care than we had in Oklahoma City, and I was struck by how much barium work they did, because the HMO patients, the gastroenterologists didn't. If they scoped the patient, that was at their own expense, and they were getting paid to manage the patients pretty much the same whether they scoped them or not. So of course everybody went for barium enemas and upper GI radiographic studies, and that was unlike what I experienced in private practice in Oklahoma City completely, because their barium was dying out rapidly because the gastroenterologist wanted to scope everybody.
Yeah. You know, one interesting trend that's gaining a foothold right now, at least as far as primary care physicians' payments go, is that it's based on an outcomes analysis. With the electronic medical record, they can analyze the outcomes, and physicians are starting to be paid on or at least I should say primary care physicians are starting to be paid on outcomes rather than the traditional fee-for-service. That certainly doesn't apply to radiologists at this point, but there's some speculation that it may in the future, as soon as the
Yeah, I
electronic.
don't have an opinion on that really. I think
Yeah.
it's obviously frightening any change, but I think something like that needs to be started on a small scale and see if it as an experiment and see if it works. Great, but it's also possible that it works for some people better than others, and somebody will wind up on the shorter end of the stick.
Yeah, yeah. Any additional advice you'd like to pass on to
Well,
prospective
I think
med
an
students?
interesting indicator is whether it's a physician. There's a lot of physicians that are unhappy with the way things have changed, and no doubt, when you go from the what I'd consider the golden age in radiology at least, but really all of medicine,
Mm-hmm.
of high pay and independence and respect from other people for the profession, and nobody when you move from that the heights of that to any change basically is liable to be negative. But we've gotten intrusion from the government, loss of power to insurance companies. We've got insurance companies needing their approval to say who you can see, where you have to go for your imaging studies, who you can see, all those things, and reimbursements getting ratcheted down. People were when government reimbursement for Medicare first came around, some people were afraid that this is trouble because we're getting paid more, but we're now we're beholden to the government, and they're getting more power over us, and they would have been right, in a sense, but in the early days it was there was an increase in payments. In any case, there's been in instance after instance a general ratcheting down of how good it is, but it's still pretty good. And I think a test, an acid test for me would be advice how people would advise their kids. And a lot of doctors say I would tell my kids never to go into medicine.
Right, right.
And my question to them is, what would you tell them to go into? Tell me something that's better. It may not be as great as it was, but tell me anything where you can get you pretty much are guaranteed of a successful career, of being comfortable financially, or even very comfortable. But certainly won't be destitute, and it's not like somebody trying to go to Hollywood and make it big in films or even in business where there's no guarantee that you'll succeed. In medicine, it's pretty well guaranteed. If you do the work and are competent, you'll have a decent career. And it's people still respect doctors, and you're still if you meet somebody new, they'll remember if you were a doctor. They'll they'll look at you a little differently, and with you'll have so you'll have the respect that's always carried. And I just can't think of unless you have a specific interest in some other area. I can't think of anything that would be better than medicine. It's very rewarding. You're helping people. There's no question that you're doing something that's noble and takes a lot of work and takes a lot of intelligence, and people grasp that immediately. And I would have no qualms whatsoever. I'd say it's not as good as it was, but it's still the best thing out there. How's that?
I think that's excellent advice. I completely agree. A lot of good points. Mike, thanks so much for your comments. Very intelligent information that we've been able to pass on to prospective medical students. So thanks so much for joining us.
My pleasure. Thanks. Take care.